Memorial Day, as you saw in that 10-day forecast, the unofficial start of the summer is this weekend, and that means vacation time for many. Airports around the country are bracing for a blockbuster Memorial Day weekend, with AAA expecting more than 3 million people to fly, hitting pre-pandemic levels. But travel, it can be dangerous for pregnant women if you don't plan ahead. So joining me now is Sheila Shitani, an OBGYN on the medical staff at Texas Health Presbyterian Hospital, Dallas. Thanks for joining us this midday.
Thank you for having me.
Of course, this is a hot topic right now. When is the best time to travel during pregnancy?
Ideally, it's during that second trimester between 14 and 28 weeks. And that's because women feel good. A lot of times that first trimester fatigue, nausea, and vomiting are gone, and you don't feel as pregnant. So you can move around pretty easily.
Yeah, I bet. I'm seeing a lot of these baby moons on social media. What should be considered when you're planning that trip, and what should you talk to, I guess, to your OBGYN first? Is there anything you should talk about?
Absolutely. You should always talk to your OBGYN before planning a trip when you're pregnant. You should also check the CDC website, just because if you are staying, whether you're staying in the country or going out of the country, you want to know about any risk for any infectious diseases like Zika, because it is still a thing in certain areas. And then you also, especially if you're going to have a longer trip, before going, seeing your OBGYN and taking a copy of your records with you. I always tell my patients, it lets other providers know that you are loved back at home. And so if you've got a copy of your records, they know that you're taking care of yourself. If you run into a problem, then it just gives those new providers a head start with your care.
Dr. Shitani, how else can you plan for the unexpected? Any questions that should be addressed if a woman travels maybe later in that pregnancy?
Yes. If a woman is traveling later in the pregnancy, a lot of times it might be for a family emergency or anything, because typically after about 36 weeks for a singleton pregnancy, we like for you to stay within the DFW Metroplex. And so if it's going to be after that time, a lot of times the airplanes don't really want you to fly because they don't want to deliver a baby on the airplane. But if you do have to go, you definitely, number one, make sure that you have your records, talk to your physician, have a visit right beforehand, especially if you're later term. Are you dilated? Are you not? What's the likelihood of you going into labor while you're away? Those are all things you really want to be concerned about.
Yeah, listen, there's some fun staycations that you can do right here in North Texas as well. What symptoms should you watch out for while traveling?
The biggest thing, especially if you're flying, you want to make sure that you're hydrated, because they dehumidify the planes. And so it's really pretty dry. And so it's always important to make sure that you're hydrated. The other thing is that for pregnant women are already at increased risk for blood clots. And so you want to make sure that you're moving around. And whether it is by plane, train, automobile, every couple of hours, you want to get up, walk around, stretch your legs. Sometimes wearing compression stockings can help as far as that's concerned, but those are things that you really want to pay attention to.
Good tips. Any more tips for that air travel and road trips?
Also making sure that you've got clean water, because you definitely don't want to get a stomach bug while you're gone. Yeah. And if you also are having some problems with nausea during your pregnancy, talk to your OBGYN. It may be beneficial to take a prescription with you to help with some of those things.
Yeah, Dr. Shitani, I'm sure you've got some of your patients that wonder, hey, after baby, when is it safe to maybe travel on that airplane with a newborn? I was wondering the same thing.
Oh, I'm sure. Yes. Congratulations to you. You're recently back from your maternity leave. Really it's going to be, I would actually ask the pediatrician as far as the baby is concerned. But as far as mom is concerned, whenever she feels like she can be up and moving around, having a C-section is different than having a vaginal delivery, so it may take a little bit longer before you start traveling after a C-section. But whenever you feel like you're ready and the pediatrician gives the go for the baby, especially when it comes to infectious diseases, then let's get away.
You're right. Before we go here, I know you had mentioned singletons, but any recommendations, I guess, or any changes if a woman is pregnant with multiples?
Absolutely. So typically, I tend to move everything forward by 4 weeks for multiples. So if I say 36 weeks for a singleton to stay in the DFW Metroplex, it's 32 weeks for multiples, just because they have a tendency to deliver a little bit earlier sometimes or other complications. And so you really want to be close to home.
Yes, and good luck to those mamas with multiples. Ooh. Dr. Shatani, thank you so much for joining us this midday.
Thank you for having me.
Of course.